short, is essentially nerve burning, and it's getting rid of and eliminating nerves that supply sensation to painful joints, either in the back or other joints throughout the body.
Okay, when you're talking about this, it sounds kind of painful, right? But it's not.
It's not. It's done under controlled circumstances. It's non-surgical, and it's done through injections. It's done through needles. And so a patient is anesthetized locally with lidocaine, very similar to Novocaine when you go to the dentist. And through that numbed area, the needle's placed to the intended target nerve.
So like you were saying, back treatment, things like that, what other things could you treat? What kind of painful things?
Yes, great question. To begin with, it started with the back, low back and neck issues, and we've been doing that for
a lot of people have
decades.
those problems.
Yes, and a lot of people have. It's one of the main reasons why people seek care with the physician yearly. Additionally, recently, within the last few years, we've identified the nerves for the knee and identified the nerves for the hip joint as well.
Also very, very painful places for people.
Absolutely.
So who is the best candidate for this? Not anybody can just walk in and say, I want this done, right?
Sure. There's a number of treatments that need to be tried, more conservative treatments to begin with. People who have chronic pain with the small joints of their back, of their hip joint, knee osteoarthritis, hip osteoarthritis, people who have tried anti-inflammatories over the counter, prescription medications, they've tried injections with cortisone type injections, other joint replacement fluids, and they've all failed those. Or they may have gotten benefit for quite some time, but they're not working for them.
So you have to try all those steps.
You really do have to try those steps first. As far as the back is concerned, there's a number of other conservative measures, physical therapy that gets tried beforehand, other types of injections as well.
So how long does this last? What's this treatment, you know?
Yeah, on average, we tell patients it's about 9 months for the treatment itself. The reason for that is that as we go in and we burn the nerves and essentially eliminate the nerves, we cause some thermal damage, and that nerve has a small lesion about the size of a rice granule. However, the body has this pretty amazing way of trying to regenerate itself. And anytime we receive a cut or a fracture, that heals. Well, anytime we burn the nerve, that will also try to regenerate and regrow. So if it does, on average, it's 9 months. And then if it regrows, it's kind of like plugging a wall socket back in, and the light can go back on. If that happens, we can always revisit. We can go back and reburn that, and that can be done repetitively if necessary.
Sounds absolutely amazing. Great treatment for people who really, really need it. Thanks so much for being with us, Doc. For more information about this procedure and to see if you might be a good candidate, just visit our website and click on this story.